system too. Oh, okay. All right.
Yeah, sorry about that.
All right, you want me, I'll just do a quick recap so that all that is included in the recording. So, hello everyone, and we're going to be talking about the chemicals that affect your child's brain. In other words, chemical toxins. And if you remember our past presentations, the first one was about the gut-brain connection, the invisible powerhouse, how things that happen in the gut affect the brain and how that manifests as autism. In the second presentation, we talked about bugs, specifically microbes like bacteria, and how they can affect brain function. But that's not the whole story. We know that fungi, we know the yeast infections, we know that viruses, we know that worms, we know that heavy metals, we know that chemical toxins can all, in fact, we also know that the mother's immune system, in some cases, not all, but there's a theory now arising that way back in pregnancy, there's something that triggers the mother's immune system that makes it affect the child's growing brain and the child's immune system, making him or her more susceptible to the autism causing agents later on in life. So many times it actually starts during pregnancy. And again, a lot of it is related to, in some cases, not all cases, but sometimes carelessness. Sometimes the mother, and I see this in my clinic a lot, especially among the poor, because our foundation reaches specifically to the poor. And maybe the mother had an infection or discharge or a fever. She didn't do anything about it. She didn't want to go to the hospital because that's going to cost money. And she just endured. She soldiered on. And then eventually you have a child that has a condition, a very severe condition like autism. In other cases, the parents don't know anything about it. It could be genetic in some cases. So there are lots of factors that are involved in this whole thing. But the bottom line, and this is what I really want to emphasize in this particular presentation, the bottom line is that whether it's bugs, whether it's viruses, whether it's the mother's immune system, the bottom line is that it is chemicals that are released by these agents, whether immune system, whether viruses, whether fungi, or the worms that eventually affect the child's brain that cause the problem. I know that's hard to believe sometimes. And the reason why I'm trying to emphasize this and taking my time to discuss this is because you see many people, especially those in the Western, abroad and in developed countries where they have access to a lot of healthcare, free healthcare, or insurance and all that. They go to the lab and they want to do all these elaborate tests, excessive tests in some cases. They want to do a series of MRIs, they do a series of CT scans, they do a series of blood tests, of stool tests, of hair tests. Certainly nothing wrong with them. But here's what most people don't know. The majority of the chemicals that you're testing for in your blood, your urine, and so on, are not really produced by your body. They are produced by the bugs. As a matter of fact, in one of the recent presentations, TV shows, I'm on TV like 4 times a week in Nigeria, and so that streams to most of Africa. And we invited, on 2 separate occasions, we invited a PhD and expert researcher in the history, in the whole idea of bugs and how the bugs affect the brain in autism. And they've started a company. And the CEO of that company, and then later on the professor of microbiology, both said the same thing, that over 50% of the metabolites and the chemicals that you're seeing in your blood are produced by bugs, whether they're by worms or whatever. And I keep going over all this 5 or 6 different kinds of bugs. They are produced by, in other words, what these bugs do is that they take the food or whatever it is that comes into your body, they metabolize it, and it's the metabolites that are entering the blood that are now being measured by the lab tests. And that's what you see. So when people do so much they spend a lot of money on these tests, and they are trying to treat based on, oh, there's too much ammonia, or there's too much amphetamines, or there's too much of this hormone, and they're treating those things. What they are doing is that they're treating the leaves rather than the fruits or the roots of the problem, because it's the bugs that are creating those things, not your human body. So the first and most important thing, and this is what I keep on emphasizing, thank God, I hope I've emphasized it to you, Asma, in our private conversations, that the first and most important thing is that you've got to, got to remove, find a way to safely and effectively remove as much as the contents of your gut, of your child's gut, as possible.
Yeah. Yeah.
And please feel free to interrupt me at any time, Asma.
Mhm.
And that takes time, but there's a safe way to do it. We specifically stay away from medications simply because of the safety factor. We want to be able to go to bed and not worrying about whether or not the child is going to have a reaction. So, we've been doing this for years now. We've seen some really good results. So the first thing you want to do, I'm going to emphasize it again. First thing you want to do is you want to find a way to get your child to push all that stuff out. Believe it or not, even if they're stooling every day, and many parents say, well, we're stooling every day. We're stooling every day. The child is stooling every day. He goes to the bathroom. There's nothing problem. There's no problem. There's no constipation. Maybe you think there's no problem, but over 70% of kids with autism have problems in their guts. I even think that's a conservative measure. It's probably 90%, in my opinion. Because once your child begins to exhibit certain behaviors, hyperactivity, aggression, interest in only certain kinds of foods, inability to concentrate. Maybe the child is just like moving around in a daze, doesn't want to interact with friends, problems with speech, problems with sleep. I guarantee you, there's something going on in your gut, there's something going on in your child's gut that is causing those things to manifest. If there was nothing wrong with your child's gut, you wouldn't be seeing those problems or those symptoms. In other words, if you take 5 kids, what we call normal kids, average kids, if you take the average of their 5 guts, I'm just giving you a hypothetical sense now. You take the average of their 5 guts, if you can improve, if your child's gut can be made to look like the average of those 5 normotypical kids, that child will not have autism. Wow. Especially with a child below the age of 6. If you would, go ahead.
Okay, so were you talking about the neurotypical kids now, or the kids on the autism spectrum?
Yes. So if you take 5 neurotypical kids, you take 5 neurotypical kids. Like I said, this is a hypothetical situation. You take the average health. Let's say you see 5 kids. You look at their 5 guts. You say, okay, this is the average of their 5 guts. You use that as like an avatar, as an example. You compare your child's guts to that average of the 5 guts. You will see some stark differences. If you are then to proceed to do the things somehow to make that your child's gut look like that normal neurotypical child's gut, if you were to approximate the 2 guts by doing some of the things that we're talking about, and do it effectively enough, you would have a child that does not have autism.
So are we saying at this point, just so that I don't start seeing parents jumping and jubilating, oh, so we finally have, something that can reverse the diagnosis? Are we saying?
And just to say real quickly, I am not saying that we have gotten there yet. So I'm giving you a hypothetical situation.
Hypothetical. Okay, yeah, you said at the beginning. Okay, so that's a disclaimer enough. Okay, that's
right.
Yeah. Okay.
Okay, and I'm saying this not only because of some of the things that we have observed in our practice, but the research that is now beginning to come out. Some of you have heard about the Fecal Microbial Transplant study that was done a few years ago. Yeah. What they did, and of course, this is not for you to do it at home. But what they did is that they got about 20 kids with severe autism. They got about 20 kids, then they were able to get 20 kids with normal. They took their poop, their feces. They took the feces out of the normal kids. Of course, and as you know, 60% of feces are made up of bacteria. over 60%, and other things as well, and other chemicals as well. So it's not just that undigested food. It's a lot. There's a huge amount of bacteria in it. And they cleaned out the toxic aspects, and they put, I know this sounds gross, and they put that feces into each of these 20 kids.
Ooh.
And that continued for about 2 weeks to a month. I'm not sure exact date now. But the point is this: after 2 years, they went back and studied these kids. Almost, I would say, over 80% of them had lost their diagnosis. They were acting like normal kids, and behaving like normal kids, and speaking like normal kids. There were others who did not fully lose their diagnosis, but they had significant improvement. That is simply from one act of doing the fecal microbial transplant called FMT. You can go online and you can find out more about it. But they're now trying to expand the study to do more and more and more of that. I know some doctors. I even have a patient who is on the waiting list to do one in Europe now. That they're wanting to do that.
I remember the last time you said there's a protocol that has changed that, and I think that's part of your protocol, right?
Yes.
Yeah.
But we don't do feces.
No, not at all. I don't think I have the guts to do this.
It involves a lot, I can tell you that.
Yeah,
so,
really.
So, trying to regain my train of thoughts now. So that is really where it comes down to. But again, I want to emphasize, it's not just about the bugs, it's not just about the worms, it's about the chemicals that are being produced that eventually affect the brain of the child. I'm going to talk about a few of these things, and please feel free. I'm not seeing questions or anything, but if there's a question that needs to be asked, please feel free to bring it up. So I think I can actually, you know what? Maybe I should bring this up so I can, so you can see it. How many people? We have 18 people on now. Okay. Can I share my screen? Asma, I'm going to need to be able to share my screen if that's okay.
Yeah.
Are you there?
Yeah, I'll just do that now. Okay, please go ahead.
Okay. I've been warned by Asma not to do too much slides. I should just show slide. I shouldn't show too much words.
Yeah, we want action, you know.
We don't want to.
We know doctors read a lot, but we parents are already overloaded, you know, and we just want to come to the webinar and just look at something enticing. Yeah, but you know, we can't take that away from doctors. So, and I think the information is most important.
I will work on trying to get better pictures, I promise.
And you are. I mean, you are. I mean, you're doing awesome. I like it. I mean, the delivery is nice. I feel what's most important is what people take away and what they put into action, right? Because sometimes you have awesome webinars that people share beautiful images and stuff, but what is the call to action? What do people do at the end of the day? Nothing. That's such a waste of time for the presenter. So right. Please go ahead.
Right. Thank you. So I'm trying to get this thing out of the way now. This thing is blocking me, which I knew what to do. Anyway, I think I can see it. Chemicals acting on the brain. So I mentioned the mother's immune system, the child's own immune system. In fact, when we studied in medical school way back, when we first knew what autism was, it was called an autoimmune condition. In other words, the child's immune system was the one attacking its brain and attacking his or her gut. Of course, we've learned a lot since then. We didn't know about bugs affecting it at that time. Mm-hmm. So number 3 here says bugs, viruses, bacteria, and so on and so forth. What we're finding out is that viruses seem to be the ones that open the door. So there's the virus, maybe there's a viral infection in pregnancy or early childhood. I mean, just one of these innocuous things that affect every child. But because of a weakness, maybe genetic, the child becomes more susceptible. And of course, there's this whole huge amount of controversy about, the V word. I'm not going to mention it before Google now comes and takes us down. But there's no controversy about it. But those injections also contain viruses, and so it makes sense that it may trigger an autoimmune a reaction in the child's brain and the child's immune system that can eventually lead to autism. But again, that's in a very tiny percentage. I don't want you to run away thinking that I'm saying one thing when I'm not saying it the other. I've had lots of kids who have come to our clinic who did not have any such reaction. They didn't even have that injection, that V injection. But they came up with, in fact, what the parents would say would be something like this. And it's always something that stressed them, maybe an emotional stress. Good example, some parents used to live in Kaduna, which is in Nigeria. They moved down south to Abuja. And they said that as soon as they moved to their new home, it was like a new environment for the child. I think it was about 2 years of age. And then that kind of, it caused them to go into a panic, and then that triggered the autism. And another example, there was this child who was very attached to their caregiver, to the nanny. The nanny had to leave, and they brought in a new nanny, and boom, that triggered something like that. A case of eventually led to autism. In another case, we've had kids who have had maybe they had an ear infection, and for a whole year they were on antibiotics. A whole year on antibiotics. Folks, for a kid, that is almost absolutely disastrous. Almost. You put a kid on antibiotics, it destroys the gut flora. In fact, they've done studies that even in adults, you do a full course of chemotherapy or antibiotic treatment for whatever condition, and it actually wipes out the good flora, the good bacteria in your gut, which opens you up to opportunistic infections like fungi and bad bacteria and bad viruses. So it's very important. Anyway, I'm saying this all this to say that it's all about chemicals, and the bugs, the viruses tend to open the door for bacteria and fungi to eventually attack. I know of people who focus only on fungi. They're all about removing candida from the body. Mm-hmm. So they use a lot of different chemical, drugs to remove candida. And in some cases, in those cases that the kids actually have candida infections, they're successful. They get good results. I've seen that people use vancomycin to get good results because it kills a specific bacteria called Clostridia, and so on and so forth. The interesting thing about parasites or worms was that many of the symptoms too that you see in autism can be caused by the chemicals that are produced by these parasites. And some of those chemicals include ammonia. Where do I have it here? So chemicals here. Chemicals, yeah. Ammonia. Ammonia kind of gives the child a dazed brain fog expression. It's like he's on drugs, which is what it is. He's dazed. He doesn't hear what you're saying to him. So you think he can't hear, and then you take them for a hearing test. Could be ammonia, could be amphetamines. There are also chemicals that are produced by the bugs in the gut that excite your child, making them have ADD or hyperactivity. Some of them have hormones that are produced. Some of them, and this, it's strange. I've seen children that actually become more, I don't want to use the word randy, but they tend to act more sexually interested. Some of you may relate to this, even with girls, not just the boys. The mother says that he seems interested in just holding my breast all the time, just touching my breast. There are other reports of kids who look under the skirts of their teachers. These are all distressing things.
Yes. Yeah.
Inflammatory signals. So the big thing with autism, right, number 6 here, inflammation of the brain. So these are things that are generated by the chemicals of the immune system. They think there's a virus that is attacking the brain, so they want to attack the virus. And there's what is called collateral damage, which affects those chemicals. They produce inflammatory chemicals which attack and affect the brain's functioning. Again, if you do a CT scan and you do an ultrasound scan, you may not even see any of these things. The doctor, the healthcare provider won't see any problem. They just say your child is normal. We can't see anything. It's because they're not catching the chemicals that are acting. So let me see
So
what I have.
the bugs secrete these toxins and they die, leave off, and then they leave off the effect, right? Is it something like that?
Sometimes the bugs don't die. They eat up your food in the guts, and then the metabolites, so the waste products from breaking down the food by the bugs, it now enters the bloodstream, which now affects the brain.
Mm.
Okay.
Wow, that's huge. I know you're not a fan of sending parents to have all these tests, which for me was a welcome idea. Remember, that was the first thing I asked you because I've done a lot of tests just to find out what chemicals were in my son's bloodstream. I even did the hair analysis for heavy metals, and quite many distressing tests for the child because taking the blood work. The
Yeah.
blood work is a lot of, so how do you know what is actually happening does that mean that everything is happening at the same time and you just treat everything?
Yeah. So again, it's not about treatment as much as it is like I said, the most important thing. We're not treating any particular symptom or any particular chemical. What we're saying is you want to clear the field. Let me see, what do we do? I mean, a good example now. So you think about like a garden, a field, for instance. You want to plant flowers, you want to plant nice trees and all that, but you go there and the place is a mess. It's a dump. Maybe there were a lot of waste that was there. There's poop, there are weeds, everything but what you want to plant.
Mm-hmm.
Okay.
Mm.
What you're envisioning is like a nice garden with the different kinds of flowers that you want there. You don't want the bad insects. You just don't want all the other stuff that is there. So the first thing you want to do is that you want the big stuff. Maybe there are rusted car tires. There's a rusted car or bicycle. Maybe there are weeds there. You want to take out all the things that just shouldn't be there first. You want to get that all out of the way.
Mm.
Once
Yeah.
you get out of the way, you can now see more clearly at what else needs to be done, which weeds need to be pulled out, what needs to be rearranged, and then what seeds, where to plant which seeds, what kind of soil is available. But if you don't take that first step to clear the whole place, you will not, all you're trying to do is just remove the weeds, or or just cutting off the leaves and trying to do something that is not really possible unless you clear the place. So what we're talking about here is we're saying, listen, there's a lot of stuff in your child's guts that is causing these problems.
Mm-hmm. Mm.
And there's a lot of now scientific evidence to that effect. We're saying let's push it all out. Help your child get it out. Help your child get it out. And that comes by stimulating, it comes by pushing, helping the child. Um, it's called peristalsis, helping your child push that thing out. And it takes time.
Mm.
As you're doing that, of course, you don't want to just push everything out without replacing. Same thing with the field, the gardening analogy. As soon as you start getting those things out, you want to start planting the good stuff so that it's not left barren. Because if you leave it barren now, that's another problem. The weeds will just rush back and grow back in, right? So you want to place with desirable seeds,
Yeah.
desirable plants. So that kind of makes sense.
Oh, yes, I mean, I've not thought of that analogy, but it's a powerful one because it brings everything so visual. I really get it. I really get it. It's just like trying to plant a seed where it's not fertile, and obviously, what kind of plants, if at all, a flower will never grow, and flowers are what we want to grow in our child's bodies, right? So
Exactly.
Yes, beautiful. I love that. I love the analogy. Thank you.
All right, thank you. So I have a slide here, just examples of certain chemicals, and some of your parents, some of our viewers here can relate to that. I mentioned random behavior. Banging of the ears could actually be an ear infection. Oh, I said injection. Is that okay? Infection. I mean, you really don't know what's actually going on. Inappropriate laughter, everybody knows, I hope. That's really, it's related to a candida infection, candida overgrowth. And it's very, very, very common in autism. And they produce chemicals that cause you to have that. Anxiety, high pain thresholds. Are you familiar with that? Or high strength, unusual strength?
High strength. I think many people. Please, can we chat so that it doesn't look like I'm the only one here with a special needs child?
Yes, please.
Which I'm very
Let's
proud of
get some
anyway.
feedback.
But then please, as doctor is asking, can you, so that you can, you can direct him as to how better to help you. For me, high pain threshold, recently we were doing some landscape in the house and there was an open concrete. And my son got his toe jabbed into one of them and it was bleeding. And he just ran up and he just washed it. I could see on his face that he was looking distressed, but that was it. That was it. No crying, nothing. And I was shocked. I said, "But we have such a high threshold, thinking it's something to be proud of, but I think we need to look beneath, under, and check."
Same as Muhammad as well. I can relate with that. Muhammad fell off the stairs and he banged his head, and it's just like for a few seconds, it was like, ouch, 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 and that was it. He never cried. He doesn't cry. For him to cry, I have to be in the A&E then. I always notice about that. Even though if he's banged his head or he injured himself, I don't know until I check his body. And I'm like, Muhammad, when did this happen? Doesn't cry. I don't know. I don't know. Like, it's scary sometimes.
It is, yeah, really. So there really is more to it that meets the eye, right? There's so much under there.
Yeah, absolutely. Thank you for sharing that, Mohiba. Anybody else can relate to that?
Or can relate to any other thing on the chat? Dr. Dayo, you're not sharing?
You want me to share again? Okay. All right, let's put it back up.
Let's see what everybody is relating to. I'm sure we all relate to at least 2, 3, if not all. Brain fog, I know we complain a lot that our kids have, is this say, not zoomed off. We say they...
zoned out.
Zoned out, yeah, zoned out. This is so common. Anxiety is also huge. Yeah, okay, I'll allow you to continue, but I'm sure we have lots of these.
Okay.
I can relate with your unusual strength as well. Each time we go to the hospital for blood tests, it has to be like 5 adults holding him down to get his blood taken. Like, they were like, it's so strong. I'm like, it's extremely strong. I don't know where I get that from.
So now you know it's the morphine. Wow. I never knew that till today, actually. Okay.
Do you know where that morphine-like substance is coming from?
No.
Okay. So what are the 3 things that's the advice you to keep from out of a child's diet? And can anybody contribute? What are the 3 things?
The sugar thing?
Huh?
Is it sugar?
No, sugar is more for hyperactivity.
Okay.
But 3 things that people tend to gluten. There you go. Thank you, Chairman. Gluten, casein, which is found in what? Milk. And then the 3rd one is soy. Gluten, so milk, casein, and soy. The 3 things that stimulate the production of these morphine-like substances.
You're going to make my life more difficult now than it already is. Amina is dancing in her chair because she asked regarding these, which I said we'll talk about later. And in another session, I'm sure you're going to talk to us about these.
What's the last thing, please? Good afternoon, Asma. What's the last one, please?
Soy.
Good afternoon, doctor.
Soy, yeah, just soy generally, yeah.
Soil.
Yeah,
S-O-Y.
Soy. Oh, soy. Thank you.
Family of legumes, yeah? It belongs to the family of the legumes, I guess.
Yes.
Soya, yeah. Exactly, soya. That's what we call it.
Soya, yeah.
Yeah.
So those are the three things that they found out that can cause the greatest amount of production of those gluten-like, those are morphine-like substances that result in pain and high pain threshold and unusual strength. I hear that and see that a lot from our patients.
Okay, so I know we are not doing the diet thing today because that's like a whole session. But if they're on your protocol, is it a possibility that they can still do well when you're giving them some supplements to reduce the amount of morphine, if that's what you do, or they still have to be on the diet?
It's advisable you're on the diet, but like I said in my earlier presentations, doing our protocol itself is laborious and very engaging, and I mean it takes a lot, especially for the first 4 weeks, because you're pushing your child, you're making sure he takes certain things, you're looking to see how he responds or she responds to it, and then you're acting accordingly. So I basically said, listen, don't bother yourself with all those other things. As long as you're giving your child those things, if whatever he wants to take, help him out. But right now we're talking about clearing. Go back to that analogy again. We're talking. What we're doing now is clearing the field. So let's focus on that. The next steps would be on, okay, let's see what we can do to reduce all these other things. And part of what we do too in further steps and further months is to help to heal up the guts. There are nutrients and nutraceuticals that can heal what is known as leaky gut, close those gaps that are allowing those chemicals and those toxins to leach into the blood vessels and eventually get to the brain. So there's another thing that needs to be done. And of course, it can be done with diet. And you've seen the videos. By the way, folks, there are lots of videos on autism. And we're going to be talking about this later on, but there are stories of people like Angela Taylor who use specifically diet, and she's in the US here, to address her child's issues. But she became a stay-at-home mother, and she only had one child, because once they knew their son had autism, they said no more children. Let's just focus on one child.
Yes.
And let's get it right. And her husband works with Google. Her husband is a senior vice president with Google. So this is Angela Taylor that you saw. So they had the resources to address this. Most of the people I have that come to me don't have such resources. And many times they have a lot of other kids. Being Nigerian, we have a lot of other kids. So they just don't have that ability to do those things. So I'm always thinking about what is the most effective, where we can hit it hard and get the best results in the shortest possible time. So everything I'm going to be talking about is I'm thinking about it. The same thing I do with sickle cell disease and cerebral palsy. I'm thinking about it from the Nigerian who does not have access to resources. I'm thinking about how we can get the best results, the most bang for the shortest possible time. And I think we've been very, very successful at it. Joma might say a few things. Joma might say a few things too soon during the call. Okay, so somebody wants to say something? Okay, she's muted. All right, so we're going to go on to how much time do we have left, Asma?
I think we have just a little over 15 minutes.
About 15 minutes.
Yeah. But we can, I think we started 6 minutes after the time. So let's say 15 minutes for the presentation, and then we can have questions, I guess.
Okay, fair enough. So I wanted to show this picture here. Like I said, we do a lot of videos. We do a lot of TV. We're on TV 4 times a week in Nigeria and around Africa. So we're always reaching out to experts in this country while I'm here who can help educate our audience. So he's the CEO, Stuart, I don't know his last name, Campbell. He's the CEO of a pharmaceutical company that is focused on producing drugs, not supplements now, but drugs that specifically target the problems with autism. And they're the ones who found out that this particular bacterium known as Bacteroides fragilis, otherwise called B. fragilis, is a key part of in autism. It plays a key role. It is missing or very deficient in autism. And they found out by putting that bacterium back into the guts of kids with autism, they can have significant improvements. But a lot of it, like we've been trying to say, what a lot of the improvements come from the secretions or the chemicals that are made by this particular bug. Once those bugs get into the system, they help to counteract the effects of the other bacteria and viruses and parasites, helping to calm the kid down, helping improving in behavior, helping even improving in speech. There's still a challenge. It's still a challenge trying to culture it and make it a probiotic. Right now, it's not available as a probiotic. I know I've been searching for that for a while, but they're the company that the owner of the company is a professor of microbiology. We had him also on our show, and he talked about the progress they've made so far. So I will keep you, like I said, I talk with researchers. I'm working with researchers all the time. So part of what we have to offer is something where you can continually be apprised of some of the developments in the field of autism. And if there are going to be any drugs or even trials going to be available, we will make sure that you also are aware of it. Those who are interested in.
That's something we always look forward to, because we will not be left at the mercy of Google, because how much research we do, and we do a lot of research experience, and how do you know which one is really efficacious? It's coming from somebody like you that's part of it. We feel, yes, then we can be able to try, with an informed decision.
Good. One of the things that they are also working on, in addition to the making the bug available, the Bacteroides fragilis available, is they also found out that there are certain drugs that they can use that will actually block the entrance of the harmful chemicals that are produced in the gut of these kids. These drugs can block or absorb or keep these toxins from escaping from the gut into the bloodstream and therefore affecting the brain. Are you following me?
Yep. Are we all following? Is it exciting? Is it a yes or yes? How exciting do you find it?
I think it's exciting.
Yes or yes, exciting. Okay.
Good. I think it's super exciting. So that is what they are working on now. He was telling me about it. He's done a full slideshow, which is also available, I guess, on our website. I have to always make sure my staff are involved in it. So there are different things. Again, this is all to underscore that the problem is the chemicals. The problem are the chemicals. If we can control the chemicals that are affecting your child's brain, we can, to a large extent, control the problems that you see with your child. And this is one of the ways. So, Asma, is this a good time to talk about the offer?
Yeah, I can't wait, no better time, because as parents, we keep listening, and all we want is, what do you have? That now you've told us what you have for us, but how do we do it?
Okay, good.
Yes, please go ahead. I'm excited.
Absolutely. Okay, great. Because there's nothing that pleases me more, really, than providing a practical solution for parents. So, and then it's always a joy when I hear the results they are getting, and you're going to hear from one of our parents too. So this is not all just theory.
Yeah, Antonia just said, "What's next?" Exactly, what's next? We're here. We enjoyed it. Okay, thank you. But what's next? Okay, now we'll hear.
We'll do it. We'll do it. So, we do have a six month process by which, and Asma and some of my parents are on it, by which we start with the first step, which is the cleansing and the clearing. And then after about 1 or 2 months, we're now going to the next stage. I talked about healing the guts, talk about addressing the brain function, and so on and so forth. Ideally, if you're treating autism in the US or elsewhere, you're talking about at least 2 years, 2.5 years. And then even after that, you're still going to keep on providing your kids with treatments. Yeah. You got to go to the therapist, you got to go to the speech therapist, the occupational therapist, and so on and so forth. We don't have any of those things in Nigeria. So I'm thinking about this from the perspective of the lowest common denominator, if you will. Those who don't have access to any of those things, all they can do is get the drugs or get the supplements and get the nutraceuticals and put it in their child's mouth and just follow the simple instructions that I give them. So with that said, I want to say this is an offer for hand-holding. We have many parents who simply will need somebody to guide them through the process. So this is a monthly, and I'll tell you what that entails. But this is like a monthly offer. You pay a subscription, you have access to these things. 15-minute private phone call from anywhere in the world. Of course, technology makes that available. We'll be doing monthly Zoom meetings, kind of like what we have here, but in a way to specifically target and answer questions or just address a specific topic. We're hoping to create a community. Asma and I have talked about this, where parents like you can really discuss and share ideas. And of course, I will be involved. I and other experts will be involved in it. We'll try and get Angela to be involved because she knows a lot about this. Her kid is now 16 or 17. He had raging autism. And as when you saw that video, he speaks like a normal kid now. He's acting like a normal kid. Amazing. And that's because of what Angela went over and beyond to learn and understand how to deal with autism. And of course, number 4, I think is really important. Some of these things obviously are expensive, and if you get in bulk, obviously, you get them cheaper. And of course, another thing is this: some companies we get these things from will not sell to any non-healthcare professional. In fact, there's a company now that will not, the supplements I use, like the Gastrix, for instance, that you had such great results with, they will not sell to a non-US doctor.
Oh, wow.
And I tried to register with them, and when they looked at my website, and they're like, oh no, he's in Nigeria, so he's not going to sell to him. I had to go through another doctor who ordered for me and now gave to me. So that's the difficulty. These things are not available even on Amazon. They're not available online, but we can help you get them.
Yeah, they're not.
So of course, I think this is really, number 6 is really, really important.
They're not available anyway. I spent the whole night. Remember when we ran out of one of the supplements? And I said, I'm going to show Dr. David that, okay, it's okay. Before he sends it, at least I have something to buffer. Nothing. I mean, what came close to it, like you said, it's not the same brand. And with the type of results we started seeing, I didn't want to go with any brand. So yeah, they need to come from you. You're the one doing the protocol, so I wouldn't want to buy it from any other person.
Yeah. And it's unfortunate. I mean, I honestly, it's not like, I want to be the number one, the only person supplying it, but there's so many people with this needs around the world. I just wish it would be possible for them to have access to these things. They don't. They don't have access to these things. We have to. And I spend a lot of time actually trying to convince them that, well, I'm in the US. I've been here for almost a year. I see patients in the US. So why don't you just send it my way? And they refused. Wow. So it wasn't the money.
Yeah.
All right. Yeah. So another thing, of course, there's going to be this growing library. I've always wanted to have like a resource that people around the world can access, and for health in general. But this is going to be specifically for autism and other learning disabilities, because that's a growing problem around the world, as you all know. So you have access to this, and then of course the other things, the latest research and collaborations, like we just talked about. Normally in the US, patients, those who seek and consult with me, they pay me over $250 a month just for the consultation and for the guidance. You say, you need to buy this, you need to buy this. Okay, what's going on with your child? Let's do a video, and they ask me questions and all that. That's $250. For this group, we are offering it for $100 a month. And that's a great offer, and if it's something that you would like to take advantage of, please either go through Asma or contact us. Any questions on this?
Any questions? Send your questions here, because this is an amazing offer. Take advantage of it, because I have already, and that's why I'm so excited to always have Dr. Dio to come back. And you know, I'm in the UAE, but I'm not undermining that the doctors are not doing well here. But I've not had someone hold my hands, and that's what I've been looking for. So just to share a very my short experience, when my son started taking the supplements, and I was seeing some changes, but obviously we will have some. When you're going through, when the system is going through changes, obviously there will be some things that I was a bit worried about. So he wasn't flushing like his system, like doctor keeps saying he needs to be flushing, you need to take out the toxins. And he was sort of, you know, uncomfortable during the night. And I called Dr. Dai, you know, and he called me so many times. I remember his therapist, I didn't tell you this, Dr. Dai. He said, how much are you paying him that he's doing this? I said, you will not believe. I'm not for now. I got the supplement and I'm paying him the monthly, but this is what he does out of passion. He said, wow. And he's in America. I said, yes. So this is how much he held my hands. You know, he was sending me messages the whole night, and I'm thinking, I'm in the UAE here, but I dare not wake my son's doctor at night to tell her, oh, there's this going on. What should I do? She'll say, come for a consultation, pay, and then I'll see you in the office. So this is how he works. And you know, for me, even though, you know, I met him a few months ago, but I see a lot of passion in him. I see him as if he wants to leave a legacy. He's doing much more than I expected I was going to get. So come up with your questions, please, as many as possible. I know many of you talk about your child having a, you know, hyperactivity and all the things he's mentioned. So this is the time for you to ask him the questions.
Would this be a good time to mention, if there are no questions yet, Chioma can...
hello.
Okay, I think Rahima wants to ask something.
Thank you, Dr. David. I was driving, so I missed a bit here and there. But I wanted to start the bit about the constipation. My son, initially when he was younger, I used to be very, very constipated. But as I'm trying to manage it, watching his diet, giving him fruits and things like that, he's just borderline. Not completely constipated, but maybe every other day, and then it will be a struggle, and not compared to what he has been before. But now that you mention things like that, that is one aspect of it that I'm worried about, because sometimes I feel what comes out of him is just too hard or too big for his age, but somehow, and I think it's because he doesn't go regularly, he doesn't drink enough, but I try to help with the drinking. But right from baby, he hasn't been a child that drinks well. Another issue that I have now that is paramount to me, he's been having continuous mouth ulcer for over a year. Continuous. If I have 2 weeks break, we've been to this specialist, that specialist, and they will just have the mouth ulcers, then there will be swelling, there will be all sort of, but that is a concern for me since he started changing his teeth. He's 7 years old now, but I can tell you from April last year, I've had records and I've been to the dentist, to the GP, and it's just because we are in the UK and it's up and down, and they seem not to. There was a time he was almost on antibiotic every other month until I've had enough of the antibiotics. So they give things like spray and all sort of cream, but it's never out of it. So that is my
so Rahima, what I get you're saying now, it's like you've started a free consultation with Dr. David. Yeah, right here. And I'm sure there are so many other questions. Of course, I'm going to allow Dr. David to answer, and thank you for bringing up your concerns. And as you can see, this is the reason why Dr. David needs you to have calls with him. But I'm sure.
Sorry, Asma. I'm going to take the offer, but I wanted him to know their background if we have to deal with that first.
Okay. No. I get it. And also there's no, you know me very well. There's no pressure on taking the offer. It's just that imagine having so many questions and having him to answer them for you during this. But then also, like you said, a lot of the symptoms you're seeing have a lot to do with the things going on inside the body. But please, Dr. David, go on. And thank you, Rahima. Thank you for.
Thank you.
Yeah, thank you, Rahima.
Sorry, my question was long. Sorry.
No, no, it wasn't. It wasn't at all. It wasn't at all. I'm just saying that imagine having all these questions answered as they come up. Because today you have 3 questions, tomorrow you're going to have 10. And after the Zoom call, we will not come on for another 2 weeks, unless until, of course, people have more interest and we start coming on every week, right, Dr. David? And so you can imagine having him to yourself, and he's very generous with his time. That doesn't mean we have to wake him up in the middle of the night. But then he would send you a WhatsApp if he knows you have some questions. He's very generous with that. And I know that from many people he's worked with. So no, your questions are highly appreciated. You're not wrong at all.
So she mentioned something about constipation, but I want to respect the fact that I asked Chioma to come on, and it's because I asked her to come on that. So if we don't mind at this point, can we let Chioma get on?
Yeah, sure, please. Yeah, we should understand. Yeah.
So what her experience, and then we can go on to the questions. But please keep on typing the questions.
Yeah, please type in your questions. We'll have them.
Chioma, are you there?
Hello. Yeah, I'm here. I'm here. Good afternoon, doctor. Good afternoon, Asma.
Hi.
Can you hear me?
Good afternoon.
Yes.
we can.
Okay. Where do I start from? Maybe you can ask me a question. Where do I start from?
Okay, so maybe we'll start how old your child is, what were the symptoms you were experiencing, how you heard about, and then of course I know you heard about us on Instagram, so through some of the work, and then the changes, we started you on the cleanse as well. So just tell us the changes you saw after that, and a few other comments.
Okay, so my son is 6 years old. Ever since we've checked his ears. But first of all, let me say this: I didn't know the sound of my son's voice. Like, he wasn't talking. I don't know if someone can relate to me. He wasn't talking. I didn't know the sound of, like, you can't say, okay, this young man's voice sounds like this. This boy's voice sounds like nothing. He wasn't talking. Wasn't making any sound. Okay, so I
think Chioma, maybe you want to change the station?
Is that a Niger network at work again?
for we went for a second opinion and they said nothing was wrong. She's suspecting autism. But it's really clear here. I can hear. How do I help now? What do I do?
Okay, we're here now.
Okay. So long story short, that doctor mentioned autism, and we went to another hospital where they said there's a specialist and all that. Fast forward, I just started researching, reading. So one day I stumbled upon Brain and Body Foundation, and I got interested. I saw some testimony. That's why I agreed to do a testimony today, because it's someone's testimony, like, well, sickle cell. In my own case, it was sickle cell. Like, okay. And then I think I read something he wrote about autism. So I'm just trying to say that testimonies help the other person, strengthens your neighbor. I think Asma mentioned that.
Yeah.
At the beginning of this Body Foundation, I visited and I met Dr. David, and he was very welcoming. He told us everything, but everything he said today, he told us about the bad bugs. We have to clear the field, then start planting afresh and all that. And okay, so we subscribed. We went ahead. We got the intraceuticals. And one very good thing I must say about Dr. David is that he will hold your hands through it. In fact, he will call you when you're not even when you don't. He will disturb you. He will make sure he will follow you through. I don't know, for lack of words, he will follow you through. He will follow you every step of the way. Are you doing this? And sometimes if I even miss some drugs, like, okay, I'm supposed to take 2, and I take 1. I give my son 1 instead of 2, and he's like, oh, but I told you 2. So let us do this. Let's do this. And I've never seen him angry. even when I miss his instructions. No. So now let me go forward to where we are right now. So now, my son, you can ask him, how are you? and he'll say, fine. You can say bye, and he'll say bye. So he talks now. And to the glory of God, he talks now, and he's happy. He's okay. Oh, social interaction. He was stay on his own before, but now you can see him playing with his sister. You can see him playing with he has one or two friends in is he talks. I know the sound water. You can say some things. Do you understand? Like that wasn't so before. And okay, we're on Pampers. Did I mention that? We're on Pampers for I think till age 4 or 5. Four. So he now okay, I have to mention this. There's a lot of ideas just popping up in my head because I'm full of things and joy. Like how far from, do you understand? Okay, so now you can send him on an errand. Like before, you just be talking and are you sure this guy is even in this same room with you? Like he's just aloof. Like he doesn't even answer his name. But now I said, hey, Nna, can on the AC for me. He will jump up with such joy and go and turn on the switch for you. So he knows what you're saying. Okay, fine. Yeah, so it's a process. We're not yet like, okay, what is your name? He will call his name and his surname, you know. How old are you? He will talk and all that. But oh my God, we've come a very, very long way.
Yeah, you're a far cry from where you started. And I mean, it's a journey, right? Yeah, exactly.
So the fact that I know I know the sound of his voice, he says some words. I send doctor videos of him talking sometimes, like I want bike, I want water, cold, you know, hot. If you turn on the shower and it's a bit hot for him, he'll say, hot. Before he wasn't talking.
No, that's good.
The fact that I can send him on an errand, like, go and get toothpick for me. I now know he understands everything I see. I'm not afraid that maybe this guy is not even here with me. He understands. And he does it. It's such joy. Yes, I must say this. And I think Dr. David also mentioned it. The first 4 weeks, the purging, the cleansing, it's not easy. I don't know. Maybe someone will benefit from this thing I'm going to say now. But if you are steadfast, if you would, I say, tighten your belt and really go for it, do it. You'll see results. Most definitely. I don't know if there's any other thing you asked me to say or ask me.
You've said a lot, I think. I mean, you know, more than anything, your authenticity shows. It's obvious that you're saying it with all your heart. You're even lost for words because you actually, you know, you feel so overwhelmed. I just wanted to, are you still on the protocol, or was there a time you felt, oh, okay, I think it's good, I can take a break?
No.
Choma, it's time to report yourself now.
No, now, dog. Okay, Doc, you know now. I am. There are times it's overwhelming. It's hard, but if you have a resolve, like if you know what you want to see, you just keep going. There's sometimes I'm a human being. You know, you might miss 1 or 2, like maybe months. At night. No months, no, not months, no, maybe days. You might miss some days, but we've not pulled out of the protocol anytime. Just conclusion of days, maybe just in 2 days, that kind of thing. But we are on it, and we are still on it. I can't pull off now.
You can't pull up. And always remember the reason why you started. So for me, you know, I used to say, oh, I always start things and I'm not consistent. It's because my why is not strong. Always, so this for all of us here, let's always remember the reason why. Why did we actually even come on this call? There are only 2 reasons why we do things. We're either moving away from pain or we're going towards pleasure. And so for many of us on this call, it could be both, it could be one could be stronger than the other. Sometimes I feel, oh, I don't like the way my child is behaving, and that's moving away from pain, but going towards the pleasure for me. So as humans, we either do an away from or towards. So for me, going towards, I see him now coming in, and I don't have to think, oh, he's going to go somewhere. I don't know where he's going. I can't call him because he can't speak, because he can't answer his name. So that thought, that feeling makes me to start what I'm doing. So it all depends on your why. So Chioma, never lose sight of the reason why you started. Remember when you said, tighten up your belt. So the first day you tightened up that belt, what made you do it? There was something.
Yeah.
So don't rest on your oars, but you've done a great job. I know how it is. Yeah. When you said he holds your hands, I mean, I know when every day I wake up in the morning, I'll say, okay, it's morning now. I'm sure Dr. Dio is about to go to bed. So at least he's not going to send me any messages, because the first time I said to my daughter, see, he's asking me these questions like he's a coach also, because he said, you've gotten the supplements, right? I said, yes. He said, have you started? I said, no. He said, any reason why you didn't start? I said, oh my God. I just said to him, no reason. Now he probed me more, and he was touching a vein in me that did not want to be touched. Why? Because I knew once I start, I did not want to stop. So I was procrastinating, what's the best day? Maybe you shouldn't go to school that day. But then I just said, just do it. There's no better day to start than a day when you are not ready. Start before you're ready, because there's never a day when we are 100% ready. So let's all start. Thank you so much, Yoma, for sharing.
Can I say something else?
Please.
I'm just full of
This is how we want to honor everybody's time, because it's way beyond an hour. Please say it in a few seconds so we can wrap up.
Yes, I will. So before, he wasn't concentrating. To teach him, he'll be gnashing his teeth and he'll be off. But now he will sit, and we're not yet there. But oh my God, we are far from where we were. Now he will sit. He can sit and take lessons in class. They even put him sometimes in normal class, mainstream class, and then goes out to the department. Do you understand? So now his concentration is there, and we are still working on his writing, tracing. Yes, but we are far from where we were. Thank you very much.
I must say a huge congratulations, because I mean it's huge. I know the feeling. You'll wake up every day feeling, oh, at least something is happening, right? There's nothing like the feeling of hopelessness. I don't know if this is going to be my life forever. Chioma, just one thing, and this is what I want all of us to do before we start any protocol. Always write down what your child was like before you start a protocol. And take data, like what was the behavior, like what times of the day does he do it, how intense was it, how frequent was it, the number of times he does it in a week. I think that's huge, because we tend to forget after starting a protocol, where we were before. And even when we share testimonials, even when we try to inspire people, like when I got the supplement box of Dr. David, I took a picture of it, hoping one day I'm going to say, this was what I did in the beginning. And then the protocol became less and less. And this is what my child is like today. So always do that. And also for your day to day, you can say, oh, okay, this is working. And you can always go back to Dr. Da, which I'm sure is going to tell you this, to say, okay, let's tweak it a little. And what I like about him, even from the beginning, he says, it's not like something set in stone. I'm going to work with you so that when we are seeing some behaviors or some intense reaction or something, which the reaction is nothing negative, we can either tweak it with like take some back, add something, do this, do that. So that's where he holds your hands again. And I'm sure Chioma knows about this.
Yes.
Thank you so much, Chioma, for sharing.
Thank you very much for having me. Thank you, sir.
Yeah. So, Dr. David, if we want to, sorry, sometimes I say David, David, but it's Dr. David on the screen, so I don't confuse people. If we want to go ahead, because I have a number of people here who just, they said to me, Asma, if it's working for your son, it's going to work for my son. Where's the link to pay? I said, come on the webinar so you ask your questions. But I could share with them the offer and then the link. So how do we pay if we want people to hop on? What's the way to do it?
So we will send you, first of all, send your interest, indicate your interest, and then we will send you actually it should be on the site. So for a while now, and let me just quickly put this out there. For a while now, most of the money and the payments have just been taken as donations to our foundation, and all has been put back into taking care of the kids with brain disorders in Nigeria, because as you know, that's my passion. Those who are the indigent, the poor, who have no access, who cannot take care of themselves. And sometimes we give as much as $500 worth of stuff to each child. So just know this. So one way to do it is just as a donation, and then you just send me the. So you go to our website, and you there's a donate button there.
Yeah.
You donate there, and then you send us the link, and then you just send us the email saying that you made the payments, and then we will.
Okay, so can we have the website here, please?
Brain and Body. Do you want me to type it, or you know it, don't you?
You can just type it so everybody can click it and probably save it as a tab, and later on go there and do it.
Sure. So it's www, for those who cannot hear, who are driving, Brain and Body Foundation.org. So by being you're not only helping yourself or your child, but you're also helping someone else's child who would not be able to repay you, and probably will not be able to get support. So that's part of what we're doing.
Once more, I'll just stop sharing. David, can you just share with us the offer again once more?
Sure.
And they can take a snapshot so that you know what I'm not going to say what your money is doing for, but what your investment is going to do for you. So just take a snapshot, share it with other people that are going, and don't forget, it's not just autism, it's cerebral palsy, it's sickle cell, and God knows what else when he keeps doing his research. So this is for mostly kids with special needs, additional needs. And Dr. Dye, I even said I'm going to do it for my kids, the neurotypicals. Like I have some of them that are very, very picky with eating, and he gets upset easily. And I'm thinking, I think there's something going on in this guy's gut. But I think let me focus on, my special one first, and then I'm also going to do mine also myself, but that's a whole different story altogether. God knows how many packs of supplements I'm going to consume with all these years of dirt. And you know what I was thinking? As parents, of course, our immunity goes down because of the stress, right? Am I right? Yeah. So obviously, I'm sure we're going to have a lot going on also.
Yes. So in fact, so there's now specific. One of the advantages of having someone like me, if I may say so, even if I say so myself, is that we research for the absolute best supplements out there. Yeah. So right now, the reason I'm in the US is to raise money to do research for the sickle cell disease, Nigeria being number 1 in the world. So that we can prove conclusively that supporting the immune system of children with sickle cell disease can have remarkable impact. So we went out of our way to really look for the best immune support supplement out there. So that would be another thing that I would recommend to all parents out there, because you're under stress. As a rule, if you have a child with special needs, you are under stress. And what does that mean? Your immune system is taking a beating. And then add the effects of COVID-19 and other ramifications, for I would say over 80% of the world have had their immune systems really, really attacked because of stress and all the other COVID-19 and so on and so forth. As a matter of fact, the immune system is one reason why the COVID-19 is so dangerous. So that if you are looking for a good immune support supplement that you are absolutely sure would work for you or for any member of your family, let us know as well. We can, hook you up. That's what I use. It's what we're using for the children with sickle cell disease.
Yeah.
For their benefit. So it's absolutely safe.
Okay, so you heard that. So don't hesitate. Reach out to Dr. David, and God willing, everything will be sorted. So any more thing you want to say, Dr. David, before we?
No, like I said, if you're going to subscribe onto this and benefit from these things. I mean, this is just the beginning. It's an ongoing concern, ever growing, ever increasing library of stuff. If you've done it, you're going to do it. Send us an email saying that you have done it, you pay for it, so we can communicate with you and get you started.
Okay, thank you so much. We'll see you next week. Thank you for coming. Dr. Dyer, thank you as usual for your generous share. And good night, everyone. Good morning, good afternoon, depending on where you're logging up from. And we'll see you in 2 weeks' time with another very, very interesting topic. If you have any topics like Rahima brought up these questions. Rahima, we didn't answer her question.
Okay, yeah, she's talked about constipation. Yeah, I mean, it's one of the key things we're finding out, and
you remember
our solution to it. I don't know, there might be other solutions for sure, but our solution is you gotta go through that first month of therapy. That's the only thing that I can really say about the situation. You gotta go through that.
Because you also need to, I'm sure you need to ask her other questions, right? When it happens, how often it happens, and all that. So Rahima, you're in good hands, and I'm sure you're hopping on, and I'm sure a lot of us are hopping on. So we'll see you in 2 weeks' time with another interesting topic. If you have any topics you in mind or something you want to find out more about, like we've just picked up, we want to do something on nutrition, please forward them to me and I'll forward them to Dr. David. Dr. David, thank you for coming, and good night, everyone. Good afternoon, and have a good day ahead.
Thank you.
Thank you, Asma. Thank you, Dr. David.
Bye.
Bye.